Stem Cells 101. We hear a lot about stem cells these days. What are they and where do they come from? How can they be used to treat disease and what is entailed? Can stem cell therapy help me, and if so, how can I get treatment? Where do I go? What can I expect? Why are stem cells so controversial? If you are looking for the answers to some or all of these questions, this webinar is for you. Welcome to Stem Cells 101, a webinar brought to you by the medical professionals at Regenestem. In this webinar, we'll explain what stem cells are and how they work in the body. We'll talk about some of the latest advances in stem cell research and some of the outstanding results we are seeing in patients. Next, we'll talk about the various uses for stem cells and the medical conditions that can be treated with them. We'll also talk about some of the controversy surrounding stem cells. If you are a patient interested in pursuing stem cell therapy, we'll talk about how to pick the right doctor and how to go about planning for your travels abroad to obtain treatment, since many of the treatment protocols we offer are not currently available in the United States. Finally, we'll talk about what to expect once you arrive at our clinic. Let's get started. Part 1. What is a stem cell? The human body is made up of cells: blood cells, muscle cells, nerve cells, bone cells, and others. Each type of cell within the human body serves a specific function. Neurons, brain cells, transmit messages through the body. Blood cells carry nutrients and remove wastes for the cells of the body. As our cells die out or become damaged, they need to be replaced. Sometimes the body handles the replacement process naturally. In other situations, it needs some help, and that's where stem cells come in. Stem cells are special in that they can self-renew. They can divide and create more stem cells. They can also mature or differentiate into specialized cells that carry out a specific function in the body. For example, say you scrape your knee. During the healing process, stem cells that exist in your body aid in producing a whole new layer of skin to replace the skin you left on the pavement. The same is true for muscle cells. A hard workout at the gym leaves minute tears in the muscle fibers. Stem cells come in and repair those tears, replacing the damaged muscle. Pretty amazing, right? Are there different types of stem cells? There are many different types of stem cells. Two primary types are embryonic stem cells and somatic or adult stem cells. Embryonic stem cells exist only in the early stages of development and are frequently obtained from embryos that are left over from infertility treatments. Adult stem cells exist in the body. We'll learn more about embryonic and adult stem cells in the next section. What is stem cell therapy? Stem cell therapy uses stem cells to replace or repair damaged cells or tissues. Stem cells may be introduced to the body through blood or by transplanting them into any tissue. Stem cell therapy has proven to be effective in treating some disorders of the blood and immune systems and some cancers. Doctors have been transferring blood stem cells by bone marrow transplant for more than 50 years now. Some newer treatments where stem cells are being used effectively include skin and cornea transplants. Other stem cell treatments are still experimental, but the results are promising. At Regenestem, we use stem cells to treat arthritis, autism, COPD, diabetes, and multiple sclerosis with excellent results. Biology of stem cells. Where do stem cells come from? Embryonic stem cells come from embryos left over from in vitro fertilization treatments. Parents give permission for the leftover embryos to be used for stem cell research. It is important to note that scientists do not create embryos for the purpose of obtaining stem cells. Only the leftovers that would otherwise be discarded as medical waste are used. Embryonic stem cells are unique because, unlike adult stem cells, they are pluripotent, which means they have the ability to transform into any type of cell. Adult stem cells are found in the various tissues of the body. Most commonly, they are collected from bone marrow and fat, also known as adipose tissue. The human umbilical cord is also a rich source of mesenchymal stem cells that are particularly well suited for treating systemic autoimmune and inflammatory conditions. The bone marrow is a common site for collecting adult stem cells. The patient's bone marrow is collected by an experienced physician. The bone marrow is drawn into syringes that are inserted through the skin on the back of the hip bones. Bone marrow collection is a relatively non-invasive procedure and can be done on an outpatient basis. Brave medical students and others may opt to donate bone marrow for stem cell research or for actual treatment if their marrow is a match for a patient in need. While bone marrow is a rich source, hematopoietic stem cells, or HSCs, are found in the bone marrow of adults, with large quantities in the pelvis, femur, and sternum. They are also found in umbilical cord blood and in small numbers in peripheral blood. As stem cells, HSC are defined by their ability to self-renew. They are also known for their multipotency, which means their ability to replenish all blood cell types. The doctors at Regenestem have found that the combination of both adipose and bone marrow is the ultimate combination to treat diseases. Believe it or not, fat cells are a rich source of stem cells. That's right. Life-saving stem cells can be harvested from the fat on your body. With the patient under local anesthesia, doctors perform liposuction to collect fat cells. Fat cells are rich in mesenchymal stem cells that are ideally suited for treating patients with autoimmune and inflammatory conditions. They also play a significant role in tissue regeneration. Stem cells from the umbilical cord come from the cord blood, the blood that is circulating through the umbilical cord to the placenta. It is rich with stem cells that can be used to treat leukemia, lymphoma, anemia, inherited blood disorders, immune disorders, and certain metabolic conditions. Parents may choose to save the cord blood following the birth of a child in case it could be useful in the future in the event that the child or a relative needs the stem cells to treat disease. Are umbilical cord tissue cells safe? Stem cells from the umbilical cord are very safe, and they have a very unique quality. The body's immune system does not recognize stem cells derived from the umbilical cord as foreign, and therefore they cannot be rejected. How do stem cells work? Stem cells are progenitor cells, which means they can differentiate into a wide range of specific cell types. Let's take the stem cells collected from fat. Here's how it works. First, a small amount of fat is taken from the waist area. Next, stem cells are separated from fat cells and activated with a low-level photoactivation device. Finally, the activated stem cells are returned back to the patient one of three ways: an IV, localized injection, or catheterization to specific organs. Once back in the body, the stem cells follow the inflammatory signals from damaged tissue and get to work repairing the damaged cells. This video shows the complete process for harvesting and administering stem cells derived from the patient's fat cell.
The following animation is designed to provide a general overview of the Regenestem procedure. First, 100 cc's of pure fat is extracted from the patient's own abdomen. The fat contains millions of dormant stem cells, seen here in purple. Yellow is fat. The fat is then placed into test tubes. Regenestem cell extraction solution is added. the fat and stem cells are then placed into a centrifuge and spun. This process gently separates the fat and stem cells. Here you can see the stem cells, in purple, have separated and are at the bottom of the test tube. Now the stem cells are transferred into one test tube and set aside. Now 50 cc's of blood is drawn from the patient to obtain platelet-rich plasma, or PRP. Whole blood is centrifuged and their PRP is at the top of the test tube. The yellow PRP is removed and added to the patient's dormant stem cells. This solution is now ready for photoactivation using the Regenestem photoactivation unit. Photoactivation of the patient's stem cells takes 15 minutes. The patient's activated stem cells are placed into a syringe. Now they are added to normal saline, ready to go back into the patient. The patient's own activated stem cells are returned via an intravenous drip lasting 1 to 2 hours. A natural healing process occurs. Injuries secrete chemokines. Stem cells are attracted to chemokines. This is called homing. The stem cells help regenerate damaged or injured tissue.
How are stem cells processed in the lab? After the stem cells have been extracted from the patient, they go to the lab where they are activated. First, the stem cells derived from fat are harvested via mini lipoaspirate, centrifuged and activated with a low-level photoactivation device. All of this is done the same day and under a laminar flow hood to ensure sterility. Results and research. Is it true that there are no serious or valid clinical research or data to support adult stem cell therapies? Stem cell research has been going on in the U.S. and Europe for the past 30 years. Adult stem cell-based therapies are already in widespread clinical use in the form of bone marrow transplants. These procedures, used to treat leukemia, lymphoma, and inherited blood disorders, save many lives every year and demonstrate the validity of stem cell transplantation as a therapeutic concept. New clinical applications are being explored using stem cells for the treatment of several degenerative diseases. While human clinical trials have begun in many of these applications, we are optimistic that successes will be possible and that new stem cell-based treatments will become available as they complete clinical trials. Adult stem cell-based therapies do offer hope to some conditions. At this point, a valid claim cannot be made of any type of cure. However, there is very solid data demonstrating improvements in many conditions. Regenestem has been extremely successful in treating patients with a wide array of illnesses. Listen to our patient testimonials and see for yourself.
Hi everybody. I decided to make this video because I wanted everybody on this planet to know how you can improve, where you know where you can know where you can find the help you can have here. My granddaughter, she's born happiest girl on the planet, walking, talking, jumping, playing, up to 15 months and something. Then we visit doctor. I mean, my daughter go with her to visit doctor for regular checkup. And he starts screaming and yelling, "Did you know you're going to be in jail if you don't give vaccine to this little girl?" My daughter make mistake. She make mistake, and little girl receive vaccine. Vaccine called MMR. From the vaccine, she start to get high temperature, head start to swelling. They go in hospital. She is in coma for 30 days. So that's happened in Canada. In Toronto, she released from hospital. Nobody wanted to help. No therapy, no nothing. If you have children like this and nobody wanted to help you, come here. Call this number. Call this number. I will start this way to tell this to world. Thank you very much to doctors from Pembroke Pine who give stem cells to my granddaughter in Cancun, Mexico. Alex Perez, Juan Castillo. They are not only doctors, they are angels, really angels. Thank you to the doctors in Hospital Galenia in Cancun. Please, you need help, medical help. I wanted you to know. You need help, just call. Just visit this medical center. Just visit this medical center.
My name is Mary Foreman. Approximately 3 years ago, I started having problems with breathing. I went to the doctor and I was diagnosed with COPD. I didn't really do much about it at that time, and it unfortunately continued to get worse. And then I had some environmental problems where I worked in my office, which caused it to turn worse, and I ended up in the hospital with respiratory failure and on a ventilator for about 6 days. When I got home after I got out of the hospital, I decided that I wanted to do whatever I could do to get as much of my life back as I could have back. I'm only 55 years old. I wasn't ready to give everything up yet. A doctor that I had been to prior to that happening had it just in bypassing mentioned they're doing wonderful things with stem cell research. So I started looking it up. And I looked it up, and I had actually been looking at it for approximately 2 years, and at some point was even willing to go out of the country to get it if I had to. And then I found this. I was so excited. For some reason, I knew this was exactly what I needed. I called my mom. I told her about it. She wasn't really familiar with what I was doing. Until then, I got her interested, and she agreed with me. She got on board with me. They do have to accept you here. I was so excited the day they accepted me. You ask Mom, I was telephoning everybody in Oklahoma City. I was so excited about that. And my hope is that after this procedure is finished, that I will still be able to do a few things that I could have done maybe 2 years ago. Walk my dog around the block, go to the mall and go shopping. I would even like to be able to walk through the airport and do a little more traveling. Because like I said, I don't feel like I'm that old yet, and I'm not ready to give it up yet. I had heard a little vaguely about stem cell research, had not really looked into it a lot. When I did, and the more I looked into it, the more I realized that if anything was going to help me, that was what it was going to be. And I had the treatment, the stem cell treatment for COPD, the IV plus the nebulizer. I did not find anything against it. Some people were very neutral about it, but I did not find anything against it, which is what, I'm glad you brought that up, made me make up my mind that the most I'm going to lose is my money if I don't make it. As it turned out, it was the best money I've ever spent in my life. I took my niece to Las Vegas in July. I had this done in April. I took Morgan to Vegas in July for her 21st birthday, just me and Morgan. I was able to travel with her. I went to the hotel. I didn't have to have help, no wheelchair or anything. I've also found that, it wasn't an overnight deal, but every day I'll be doing something and I think, oh, why? I couldn't have done this.
State of the industry today. Are there ethical issues surrounding stem cell therapy? While there is some controversy surrounding fetal and embryonic stem cells, there is no controversy over the use of adult stem cells. Both the Catholic and Southern Baptist Church have issued papers which actually encourage research and the use of adult stem cells in the treatment of human disease as an ethically acceptable alternative to the use of fetal and embryonic stem cells. How to pick the right doctor. Who are the doctors associated with Regenestem? Regenestem is an international medical practice company focused on providing comprehensive medical solutions for adult stem cell treatments and research. Regenestem has assembled a comprehensive medical staff of specialist professionals who are trained in the latest and most cutting edge of cellular medicine. We are dedicated to provide the finest medical solutions to help improve your health and quality of life. Regenestem constantly investigates, shares, utilizes, and integrates the latest protocols in the adult stem cell arena to provide the best medical solutions for our patients. Regenestem is committed to identify the leading treatments in the field and then train our practitioners with trainers who have an impeccable scientific background so we can offer these therapies to their patients. I have so many questions. Will the doctors at Regenestem take time to answer them? The decision to try stem cell therapy is a serious one. Of course you have questions. All of our patients do. Relax. You've come to the right place. Regenestem is the source for stem cell medicine information. Patients have many questions about stem cell medicine. To make matters worse, there is a huge amount of misinformation circulating regarding stem cell therapy. As a result, many patients have no idea who to trust or how to proceed. At Regenestem, you will find that we strive to provide the facts and the information that you need to make the best possible decision for your future. Regenestem is your solution. Are the doctors at Regenestem certified? Of course they are. Our company has chosen the most reputable facilities around the world for your stem cell treatment, and we have assembled a dedicated, superior, highly trained, and experienced medical staff of specialists to meet your needs. We only work with certified, trusted specialists who perform in our safe, controlled, and professional environment. We are tireless advocates for our patients and ensure that they receive nothing but the best in stem cell medicine. How to travel abroad. Where are Regenestem's offices and facilities located, and what are they like? Regenestem has offices in Miami, Florida. Regenestem clinicians work out of the modern Amerimont Hospital in Cancun, Mexico, and Costa Med in Cozumel, Mexico. We have recently opened 3 new facilities: Far Eastern University in Manila, Philippines, and University of Nuevo León in Monterrey, Mexico, and University Maimonides in Buenos Aires, Argentina. In the second quarter of 2014, we will have our 6th facility in Medical City, Dubai, United Arab Emirates. When patients come to Cancun for treatment, they stay in the lovely, well-appointed oceanfront Cancun Marriott. The accommodations are lovely and comfortable. Imagine the sound of the ocean lulling you to sleep the night before your procedure and throughout your recovery. Regenestem's clinics in Mexico and around the world are modern, offering state-of-the-art equipment and a highly trained staff of professionals completely committed to providing you with world-class care. Maybe you are wondering why patients must travel outside the United States to receive stem cell therapy. At this time, most stem cell procedures are not FDA approved in the United States. Additionally, medical costs are significantly less expensive in countries outside the U.S. What to expect? How long does it take to see results after stem cell treatment? Each treatment and patient is unique. There is no guarantee on what results you will see or how long it will take. Some patients report improvement almost immediately. Others report improvement within 3 to 6 months of returning home. Some pathologies may require multiple treatments to get the best possible results. How much does treatment cost? Treatment cost depends on the type of treatment. Cost will be discussed following the patient application and diagnosis. The cost of treatment includes the treatment itself, medical examinations and tests, hotel, airport pickup, and transportation between your hotel and the clinic. Will my insurance cover the costs of treatment? Insurance does not cover adult stem cell therapy. Is physical therapy or rehab needed after treatment? Yes, physical therapy will be prescribed according to each patient's needs, and it will be provided during the course of treatment. In most cases, our team recommends 15 to 30 sessions of hyperbaric oxygen treatments following stem cell procedures. What about side effects? Aside from initial pain at the injection site, the patient will not experience any discomfort. Less than 10% of patients experience minor fevers, headaches, nausea, or vomiting. These minor side effects usually resolve in less than 24 hours. No long-term side effects have been reported in over 1,000 cases. Will the doctor prescribe any medications? The doctors do not prescribe any medications with stem cell therapy. They do, however, recommend a circulating stem cell enhancing supplement regimen following treatment. What about smoking and drinking? Alcohol consumption and cigarette smoking can both be detrimental to the new progenitor stem cells. It is highly advisable that patients refrain from smoking and drinking before and after getting the treatment. How can I schedule a consultation? To schedule a consultation, call Regenestem now at 305-224-1858.